Good afternoon to one and all, and bom dia to all the Brazilian veterinarians out here. First of all, on behalf of entire organizing committee, I sincerely apologize to all for yesterday as we had to reschedule the webinar to today due to adverse weather condition and unavoidable circumstances. A warm welcome to everyone as we are about to begin our webinar on avian orthopedics by our adjunct speaker, Dr. Plinio Mantovani. It is a delight to have you all again with us on this platform. Thank you all for joining us. And special thanks to our today's speaker, Dr. Plinio from Brazil. It is my privilege to introduce to you a very close friend of mine and an exemplary wildlife vet from whom I have also learned several techniques for avian orthopedics. Our today's speaker, Dr. Plinio Mantovani. He did his graduation and master's from Minas Gerais Federal University, Brazil, with special emphasis in veterinary clinics and surgery. And his research area is pertinent selectively and specialization in orthopedics and traumatology. He has worked with wildlife rescue, rehabilitation, and several conservation projects for 9 years, which especially on Lear Macaw's rescue project. He has participated for 3 years with Gerais Charitable Trust for Karuna Abhiyan, that is Uttarayan Save Bird campaign in 2017, 18, and 2020 at Ahmedabad, Gujarat. Currently, he is working as a wild animal surgeon for two states, Sao Paulo and Minas Gerais in Brazil, and he is even a coordinator for Lear Macaw rescue program. Further, talking about today's topic, that is decision making in avian orthopedics. The successful repair of avian fracture requires knowledge of the unique characteristic of birds as well as an understanding of basic orthopedic principle and how to adapt them. The ultimate goal of orthopedic repair is to return the patient to normal function. In wild birds, anything less compromises their ability to survive in the wild and is an ethical consideration for release. The avian orthopedic patient presents unique challenges. Their bones are very thin, brittle corticals, and they even tend to break, may even shatter at times. So the surgical intervention intended for repair of avian orthopedics, these points are also to be kept in mind. So with the view of same, I request Dr. Plinio to enlighten us with current and cutting edge reference for avian orthopedics, which can help us in easy decision making for repair of fractures in avian patients. Dr. Plinio, please.
Hello, everybody. Can you hear me?
Yes.
Yes.
Yes, okay. Well, thank you again for the invitation. It's a pleasure to be here speaking with you all again. I appreciate your attention and your understanding about the situation yesterday. And hopefully today we'll have a pleasant presentation and everything will go well. Um, First, I would like to start thanking all the Indian Society for Veterinary Surgery in the name of Dr. Deepak Patil, who's the executive secretary and made all this possible. Dr. Divyesh, which is a close friend of mine, and invited me to do this presentation and speak about this huge topic that is avian orthopedics. And when he first asked me, I wondered what could I say in around only 1 hour, 190 minutes. And one thing that I have spent a lot of time discussing with a lot of avian orthopedicians is how do we properly choose the options that we have available in orthopedics to use them in avian orthopedics. So I've gathered with the help of a lot of colleagues, a lot of I've gathered a few flowcharts of decision making that can be very useful to use in everyday use, and may help us to decide what can be used in specific avian patients. We'll have for this evening and around a 90 minutes talk that I will discuss a few topics on avian orthopedics. I will show you what type of fixations do we usually use, what do we have available, what can be used, and what I think works the most, and what are our new challenges. And I will spend most of the time speaking of these decision-making flowcharts. First, as a disclaimer, I should all make you aware that in avian medicine, we extrapolate a lot. We do not have systematic reviews papers of all the treatments available or possible in every avian species. So it is almost impossible to do this. We'll see that we have over 10,000 of avian species. So as we discuss orthopedics in this whole class of animal, it is very hard to find species-specific papers or research. So we tend to extrapolate a lot, and these flowcharts that we develop, it's has a lot of it, and it has a lot of empiric experience on this, but it's not only mine experience. And I have the pleasure to organize and to work with a lot of colleagues in 3 workshops on avian orthopedics held by the 2 for the Abravas Congress. The Abravas is the Brazilian Wild Animal Veterinary Association, and 1 for the ASAB Congress, that is the Brazilian Association for Zoos and Aquariums. And also we did this workshop as a part of the residence program in Brasilia's university. So it's, even though it has empiric experience on it, it is from a lot of, it has a collaboration of a lot of colleagues, even some colleagues from India. I will not say any names, otherwise I will forget anyone, and that would not be fair. But it's not only mine experience, but we have this for the collaboration for with a lot of other colleagues. I should make sure that I have no commercial relationship with any instrument or implant brand, and all these techniques should be seen only as suggestions and should only be performed by certified professionals, and I have no responsibility for misuse of any of them. And none of these techniques I invented myself. None of them came out of my head. They are all well established in avian medicine literature. And I suggest all these 5-6 books as our main literature reference. And as I have specific papers that deals with each topic, I will show them throughout the presentation. So as I said, when we speak of avian orthopedics, we are speaking of a whole animal class, which comprehends more than 10,000 species. So we have huge variations from species to species. And if we see the orthopedics as a whole science, we will speak of all the pathologies of the musculoskeletal system. And for the birds, we also should gather the integumentary system because the feathers are essential part for their flight. And any pathology of the feathers will imply in changes of flight also. So it's one more thing to add to this planning. To narrow our presentation, I will speak only of fracture treatment because fractures are the most common injuries of the musculoskeletal system of birds, especially if we are speaking of rescue centers and free-ranging birds. So the trauma cases are most common. And as part of their specific anatomic conditions, fractures are often presented with other injuries like muscle disruption, skin disruption. So it's very common that we see exposed fractures, and this implies in other problems for this patient as infection and blood loss. So fractures in birds are associated with high morbidity, so they represent a huge impact of this patient's life, and this event will change its life forever in most cases. And we have a high mortality rate when dealing with these cases, especially if we compare them to domestic animals. So fractures in birds are a very special thing that we should really know how to handle. And it's something that our team need to always be aware of and always be constantly training if we want to get better results. We have a lot of factors involving fractures in birds, and most of them, from the occurrence to the resolution, will have the human factor involved in it. So for pet birds, we have a lot of objects in their houses that can produce fractures, like a simple door opening or a fan, and that can lead to fractures. And in aviary birds from breeders or zoos, we have the objects in their facilities or the aviaries, and in some day that they need to do like physical restraining, and maybe the bird can hit some objects, or the employer sometimes doesn't have experience and can hit the bird and cause these fractures. And for the free-ranging birds, we have a lot of anthropic interactions like glass or vehicle collisions, kite string injuries. These are very common in India and also very common in Brazil. We have gunshot wounds and lesions related to use of mice trap. One thing that we should always be gathering information and studying is what type of birds are we treating, and we should always tend to know and treat this bird and take care of this bird with a species-based knowledge. But like I said, there are more than 10,000 species, and this number is not even accurate. And so we are still discovering new species of birds, and you can imagine what do we know about the specific bone characteristics of this species, this new species. We actually don't know anything, so we tend to extrapolate. And one taxonomic level that we should always keep in mind is the order. So if we don't know anything about that specific species, we should always have in mind what are the requirements for those order in that species belongs. If we imagine that only for threatened birds we have almost 200 species to know about, they're actually going away and we don't know anything. We have lots of work still to do, and unfortunately we don't have time for this, so it's very common to extrapolate our knowledge and our planning from other species, but we should always try to make it as close in the taxonomic level of the species. If not possible, we should stay with the order. And as time goes by, we will see that we have most commonly routine, and we should try to gather our equipments and our implants to treat these specific type of birds, because they can vary a lot on the anatomy. For example, if you treat passerines, you treat birds of less than 20 grams, and these are huge challenge for orthopedics, and we do not have implants that fit these bones. They are too thin. Sometimes we adapt needles or catheters to use as pins, and that can be done, but they are very challenging. We have birds that have a huge wingspan and proportionally very long bones, that if you try to plate this bone, you have to have very specific and long plates that actually we do not have available yet. And if we work with raptors, you see that they require a lot of neuromuscular skills to flight. They need an active flight to hunt. So we have to have excellent results with these guys, especially these guys. I would compare these as Olympic athlete, and otherwise we have free-ranging birds that are very generalists. In India, for example, we have the black kite. Movus migrans is a very generalistic bird. It's very well adapted to the urban life. It can eat almost anything. It can survive eating trash. So it's a very adapted to the human contact. It's a bird of a medium to large size. It's a very good bird to start practicing, because you will not have many difficult with the handling at all. And pet birds are getting each year more common. And in Brazil, the most common pet bird are the cockatiels, and they are psittacines, this bird with a curved beak. And these birds are very good pets, and inside their houses, they don't require much of their function as flyers. So we could um, expect minor result or a not very good result with these pet birds, and this will not make a huge impact on their lives. And on the other hand, we have some birds that are extremely rare, and they require a lot to live in the wild. So an event of a traumatology event would be very it would be not good for this individual. But even though if it cannot be released back to nature, there are captivity programs that will take care of this bird and will try to reproduce this bird. So we should try to keep this bird alive as many as we can, because it is still have reproductive importance. We can still access its genetics by this way. So some species, especially threatened species, even if we have to amputate one limb, we would still keep this bird alive without one limb to see if we can access its genetics. So we have a lot of way to work with avian orthopedics, and each one of them will require and most perfection result. So why it is so difficult to do avian orthopedics or to treat fractures in birds? And actually, because the avian bone is a little bit different from the mammal, we have low density trabecular bone. So the bone is in some way less dense, and overall it's less dense than the mammal bone. We'll have in some cases pneumatic bone, so it will even has less trabecular bone inside of it. The humerus is a classical pneumatic bone. And the corticals are very thin, but actually they are very hard. And as they are thinner than the mammals, and the only hard part of the bone, we can say like this, our implants will only be fixed in this thin cortical. So we should be aware of this. I suggest this paper, Basic Avian Bone Growth and Healing, is a classical paper. We could say it's a little bit old now, but it's one of the few papers that review all the avian bone growth and healing. It is in most particular way similar to mammals in all its phases. But with this difference that I mentioned. And even though it has a thinner cortices, this cortices has great resistance to bending. And so we cannot say that the avian bone is fragile comparatively with the whole bird weight and the whole bone weight and what the forces that go through these bones while they are flying, we will see that actually they are very well adapted and they are really strong for the forces that they evolved to handle. And unfortunately, when we submit these bones to unusual forces, and they will break, and things they are really hard structure, they tend to shear, and the nature of the avian movement involves lot of energy. So we tend to see multiple fractures, comminuted fractures, and like I said, they don't have much muscle cover and a thin skin. So it's very used to see exposed fractures. Um, when we try to treat these fractures, one thing that we should have in mind, and I will come to this many times in this presentation, is that we have to accomplish some principles, to create the ideal environment for the fracture to heal. And we have these four pillars, I tend to say, and that we should balance them and look for them when we are choosing any type of fixation. And the way that I choose to, the way that I use to choose which type of fixation is better than the other one is to compare them thinking of these four principles, which is the first one, restore normal anatomic relationships. So it's not that we have to set a puzzle, but we have to bring all the great bone segments in normal axis and put this bone back to normal length. We have to we have to maintain these segments of bone fixed. So we have to choose a type of fixations that provide stability for the times that this fracture needs to heal. We tend to see birds as a high metabolic patient, and we tend to think that all the healing will be faster in birds. That is true if we provide correct nutritional support. And what I see many times that when we are treating free-ranging birds, that we have very difficult to attend this requirement, and I do not see birds healing fractures in 3 weeks like some laboratory studies show. They tend to heal around 4 to 6 weeks. So we have to do a fixation that provides stability for this amount of times, around 4 to 6 weeks. And we have to preserve blood supply by doing atraumatic tissue handling. So there are many ways to approach a fracture, minimally invasive or open reduction or conservative way. And the one that we can preserve the most of the blood supply will provide the better environment for fracture healing. And one thing that is sure is that when we provide early mobilization, when the animal can have a free range of motion of all the joints, when it can use its legs, when it can force its muscles, we'll have fast recovery. So we should always look for these four principles when choosing a type of fixation. And we should always have in mind that our main objective is to recovery full function of this limb. We have to have in mind what will be the real need for this bird. And if we are dealing with free ranging birds and we are we want to release this bird back to nature, we would only be happy with full functional recovery. But for pet birds, especially uh, um, citizens, we don't have this require, so they can have a very good life without using of one limb. But this is not true for free-ranging animals. So when we speak of restore normal anatomic relationships, we are talking about putting all the bone pieces together. When we choose our fracture fixation, we need to choose between external coaptation, our bandages, external fixation. There are many types of external fixators, and we have options of internal fixation also. And when I speak of a traumatic tissue handling, is this type of skill development. First surgeries, we tend to open a lot, we tend to release more muscle than we needed to. Um, with a few practice, we tend to open only what's needed, but we should develop our skills to minimally invasive surgeries. And this is not one thing that depends only on our skills, but also on the imaging equipments that we have available to use during surgeries. So as we tend to, as I said, that free-ranging birds need full recovery. This is not an orthopedic case. This is just a slow motion of an owl on the landing phase. And we can see the complex of the movements that require the birds to control its speeds while flying and to land in a proper way. And many of birds that are hunters, they really need full alignment of the limb, because as they will hit its prey, they will have returning force on the bone, and if this bone is not proper aligned, this can lead to other fractures or luxations. And there are some birds that require lots of speed to hunt, so they feeding nature require surprise, and if they do not can accomplish this amount of speeds, they will not be able to hunt its prey and will not be able to feed. So for free-ranging birds, we should not expect anything than the perfection. And there are some types of birds that do a very complex movement to flight, like the hummingbirds. And if we try to treat a hummingbird fracture, I think this will be the ultimate challenge of avian orthopedics, because it's a less than 10-gram animal with a very complex movement. So this is very difficult to accomplish. This is a Lear's Macaw after humerus fracture, the one that I showed a few slides before. We can see that it can fly, but if you look for um, the movement between each wing, you see that they're limping one wing. It is limping one wing. So this bird's right wing does not have a full range of motion, and even though it does not fall like a rock on the floor, this specific species require a flight of more than 20 kilometers per day to reach its feeding area. So we do not felt comfortable of taking these birds to full rehabilitation and releasing it back to the nature. And this bird was incorporated in the captivity program to reproduce, and its chicks will be sent to reintroduction. So when we speak of results of avian fracture treatment, we see a huge range of results from 20% to 80% of good results. That will depend on the species, on the type of breeding, if this bird is a pet bird, if it is an aviary bird, a zoo bird, or if it is a free-ranging bird. And like I said, generalist species are easier to treat, to handle. This is caracara. It's a South American bird. It's very similar to the black kite in its generalistic life. And this bird can live very well without long flights or without being able to accomplish the highest flights. If it can run from a dog, if it can fly away from a person, this bird will survive. This is a very special case that I did this year. Actually, during the pandemics in Brazil, we've seen a rise on the entropic interactions, the worst ones, a lot of gunshot wounds, and we had a off-season kite string injured season during the pandemics. This is special bird of prey. It has a forest way of living. It flies within the forest, inside the leaves of the tree. So it has, it needs to have a very special ability of flying, of deviating from the tree branches and leaves. And this bird was found shot with this type of fracture. And the first thing that the people from the rescue center thought that they should euthanize this bird. But then one zoo got interested in these specimens because it's a very beautiful bird and it's a rare bird. But only if we could save its wing. And we did an open reduction, internal fixation with bone plate and screws, and we could manage to fix the fracture, but and save the wing, but the bird could not fly like it did anymore. This video was still in the rescue facilities, but now this bird is at a zoo, and his case is being used as environmental educational purposes. And I think it's a very good way to keep this bird as an ambassador for good practice and what interactions can lead to. So I see this as a justification to keep this bird alive. In Brazil, we tend to be very practical on this. We have specific regulations that guide us on how to deal with free-ranging animals. So we tend to treat only threatened birds, birds that have a specific captivity program, or birds that are that already have a place in a zoo before we try to treat them. Otherwise, we would have a lot of birds that will have no destiny, and we will fill all the rescue centers cages with very common birds and unreleasable birds. And one thing that got me very interested in going to India and work with all the Indian veterinarians, it's because they tend to treat all species like it's the last one on the planet. So all the efforts are made for every species, independent on if it's threatened, if it's a beautiful one, or not. So this is a video of first batch of pigeon. It's a release of the first batch of pigeons injured by kite string on the year of 2000. So pigeons are a very good bird to work with. I joke that pigeons can fly with only one wing, so it's very satisfying to treat fractures on pigeons because they tend to heal well and they tend to fly and they are very easy to handle in captivity. So it's a good species to start working with, and so that we not be very frustrated. We have this prognosis table that I tend to look for when I'm uh, deciding if we should go for full treatment or what are the expectations on when we go for full treatment on that particular case. For example, free-ranging birds will have a poor prognosis than captivity bird, and we could say that zoo birds have a poor prognosis than pet birds. So pet birds are birds with a good prognosis for fracture treatment. If we only have the fracture itself, it's easier to treat, but if we are dealing with a situation of an infection and or uh, a nutritional deficiency also, or liver deficiency will be harder to treat. Those extremely small species, I would say with less than 100 grams, and those extremely large species, we have birds with more than 100 kilograms, like the ostriches. They are very hard to deal with. I would not go that far. I would say that bird with more than 3 to 4 kilos are very hard to treat, and birds with around 500 to grams or to 1 kilo, like a macaw, they are easier to treat. If we have a closed fracture, easier than an open fracture. Simple fracture, easier than multiple fractures. Little muscular or neurological damage, easier than when we have great soft tissue damage. And when we treat them with a little time between the event, the trauma event, and the definitive treatment that we are proposing, it's easier than when we wait a lot of time to treat them. So this is a prognosis table that we should always have in mind and to decide to treat a bird. So coming back to the principles of fracture management, restore anatomic relationships, do a fixation providing stability, a traumatic tissue handling and early mobilization. We will do our planning for this treatment. And we should take as much time needed to plan this treatment. We have this phrase, very famous phrase on orthopedics, that fail to plan is planning to fail. And we should always have in mind that we need diagnostics. First thing that we need to have is diagnostics, and the diagnostics involves full clinical exam, and this involves not even knowing the species that we are dealing with, but also the type of husbandry that these species will need. If it is a pet bird, a captivity bird, or a free-ranging bird, we should always have this in mind. And we should then have our complementary exams. We do not treat an X-ray, we treat a patient. And this is one thing that we always have to have in mind. And then we'll do the 4A's technique to choose our approach, our implants, which type of implants, which size of implants. And we will always have a plan A, that's what I want to do, what will be the best for these patients. If I cannot do this, what can I do then? It's my plan B. And as I said, bird bones tend to break. We can break this during surgery, so we always have to have a plan C or D, because things can go very different from the start during surgery. The 4A's technique is the 4 things that I should look on X-ray to plan my surgery and to see if it went well and what is going on, what will be my next step. And these 4A's stand for alignment, apposition, it's the same as reduction. 3 is apparatus, and 4 is activity. So this is a X-ray from free-ranging Lear Macaw. We can see lots of soft tissue swelling here. This is a 3rd day from the trauma X-ray. And we can also see high opaque object here that is similar to metal. We can say that this is gunshot wound, and since it's not on the fracture site and I only have a simple fracture here, I would say that this bullet hit its shoulder but did not break the bone. The bone broke as the bird fell on the floor, because I only see one simple line of fracture here. And one thing that is very important in imaging for orthopedics is to measure our X-ray. So if we are doing an X-ray, already thinking of planning orthopedic surgery, we always should measure bone segments length, whole bone length, bone diameter, medullary canal diameter. These are all measurements that we will use to choose our implants. One thing that it's starting to get common for us here in Brazil is the use of computed tomography. This leads to a whole new level of planning, um, to acquiring measurements and even allowing us to see in a three-dimensional view and to print the bones on plastic models and to do the surgery before on the plastic models to see if our implants will fit, if they are well chosen. I see a very useful use of the computed tomography to plan deformities, but it's not the topic of this presentation, but I tend to use more tomography to plan um, deformities treatments. Okay. Okay. So how do I choose my approach? I have basically two approaches of treatments. A conservative approach, where I will treat the fracture with bandages. An advantage of this is I have minimal tissue damage and it's very low cost. But the disadvantage is that it is difficult to restore anatomy, especially if we are speaking of a femur fracture. We cannot immobilize it very well. We cannot make sure that we restore the anatomy. That is the same for humerus fracture. Without any internal implants, it's very hard to restore this anatomy and make sure that we'll get this anatomy while we were doing the bandage. And another disadvantage is that the bandages provides immobilizations of the joints and misuse or disuse of the muscles, and we'll have then muscle atrophy, articular capsule atrophy, and a lower range of motion of the joints. And so if you need 4 to 6 weeks to heal a bone, this particular bone that is on bandages for 6 weeks, maybe this bird won't open its wing like it should be ever again. Another approach is to do surgery, and an advantage of doing surgery is that we have better access to do a proper reduction. So we have better anatomy restoration with this. We got better alignment with the bone that is fractured, and most surgeries provide early mobilization. Bird can still move its wings, can still move its legs, can use its wings, and will stretch it, will eventually flap its wings. I'm not saying that the bird will fly with an external fixator, but this allow for better joint environment. And disadvantage of a surgery approach is that we will do more tissue damage, and this is a very important thing when we are choosing between open reduction and internal fixation, because the ORIF approach it does more tissue damage than the minimally invasive osteosynthesis approach, the MIO approach. I have not seen any article or case report of a MIPO approach, minimally invasive plate osteosynthesis, but we can use external fixators with minimally invasive techniques, and so we'll not have a lot of tissue damage. But in general ways, surgery are has higher cost than a conservative approach. So this we always have to have in mind. Oops, sorry. And this is an open reduction approach for humerus osteosynthesis. And this is a minimally invasive osteosynthesis with the use of a tie-in fixator for the tibial tarsus. And you can see here that the fixation was done without any skin incisions or muscle incisions. So we have a good blood supply to the fracture site this way. So when we choose the type of fixation, one thing that we have to have in mind always is that to provide a good environment, we need to neuter the action forces that go through the bone, which are the bending forces, the torsional forces, axial forces like compression and distraction, and the shearing forces. There are actually 5 forces that act on bones. And if we choose to use external coaptation techniques like the bandages, we have to have this in mind that they are mostly indicated for small and easy handling species, so birds with less than 100 grams. I would say passerines or budgerigars, but mostly passerines tend to treat them with bandages. Chick birds, so young birds, fractures that are incomplete, stable, easy reduction fractures, for example, fractures of the tibial tarsus diaphysis. It's right in the middle of the bone. You do not have many muscle cover, so you can catch the bone and put it on place. You have almost 100% sure that you put it on place because you can feel it. So these are the type of fractures that I tend to use bandages. Disadvantages of the bandages is it is difficult to reduce bones that have great muscle coverage, for example, the femur. Unstable fractures, for example, comminuted fractures, and it's hard to stabilize them with the bandages, and we have to do we have to manage this bandage. If the fractures will take 6 weeks to heal, we'll have to manage this bandage for 6 weeks. And everyone that kept a bird on a cage knows that the bird tends to swim on the plate that we put water, so we'll have to change these bandages over and over again. If it is a bird of prey, they tend to pick and push all the cotton brands from the bandaging, so we have to protect them. Psittacines have a strong beak, so they tend to rip the bandage off. So we'll have to keep this in mind that this will require constant managing. A bandage should be comfortable, should be tight but not too tight, especially if you wrap the body of the birds with the bandage. So the bird will need to expand its chest to breathe. So you have to make sure this will the bird will be able to breathe with it. But the main objective and the main use that I use external coaptation is to provide protection and support for the limb. While I am stabilizing this bird, while I am planning the surgery, while I am planning the final stabilization technique. One thing that we always have in mind is to correctly immobilize one part. We should always immobilize one joint up and all joints low that fracture site. So here are the most common bird bandages. Figure of eight bandage is the classical bandage for the bird's wings. We should always know how to do this. But only the figure of eight bandage do not immobilize the shoulder joint. So only this is not enough to stabilize the humerus. To stabilize humerus or shoulder or coracoid fractures, we need to wrap the body of the bird around its wings. Uh, we have L splints. That is this splint with wire that provides stability for the bone. Another classical bird bandage is called ball bandage. We used to do this for very low tarsus metatarsus fracture or phalanx fractures. We can do shoes to stabilize phalanx fractures. It is described the use of splints. I do not like these. They're not very comfortable. And one classical bandage for pelvic limb is called the Altman splint. We do like a sandwich with paper tape over the bone. We put in an atomic position and do like a sandwich with paper tape. And this is very useful in smaller species, especially passerines. For internal fixation, we can use intramedullary pinning. We have a wide variety of pin diameters. In Brazil, we only call them intramedullary pin, but it's the most similar to the K-wire that we'll have. A few measurements are different. So these are the measurements that I can find commercially available around here. 0.8 millimeters, 1 millimeter, 1.2, 1.5, 2, until 3 millimeters will be the larger diameter pin that I will always use on birds. If I need to put larger pins, I will put more than one. Never used a larger pin than 3 millimeters. And we can even have smaller than 0.8 millimeters if we check for the orthodontic hardwire materials available. Mostly of intramedullary pinnings, we do not need power drills to put them in avian bones. We will easily use hand chucks to put these pins. And for even smaller species or in some emergency conditions, I can use needles as catheter needles as pins as well. And one thing that is documented in literature is that threaded pins, especially those pins with more threads per area, they tend to fix better. Like I said, birds have thin cortices, and that's the part where the pin will hold in the bone. And if we have more threads per area, and it will hold better. So we do not have this information for every bird species. It's only one study on butios. We extrapolate them for all the other ones. One thing that we should have in mind that the one intramedullary pin only neuter bending forces. It do not act alone on rotational or axial forces. So we do not use intermedullary pinning alone. We always use intermedullary pinning together with another type of fixation. It can be two pins, multiple pinning, it can be an external fixator, or it can be a pin in the bandage. So we do the surgery to reduce and restore normal anatomy. We use the pin to keep these bone segments aligned, but only the pin will not neuter all the forces. So we will use the bandage to neuter all other forces. I choose my pin diameter based on the medullary canal diameter, and I tend to use pins with 1/3 to 2/3 of the medullary canal diameter. And when I will use a complementary system that will not need any of the internal space of the bone. For example, a pin in a cerclage or a pin in a bandage, I will choose a pin as close to 2/3 of the diameter. And when I will use complementary methods that will need some space inside the bone, like this percutaneous pin of external fixator or a screw from plating screw system, I will choose my pin as close to 1/3 to the medullary canal diameter. This is an X-ray of supracondylar femur fracture of blue-fronted Amazon treated with multiple pinning, crossed pinning. We can do this, and when we have metaphyseal fractures, almost epiphyseal fractures, one thing that we need to accomplish is that the pin should cross over the fracture line, always ahead of the fracture line. So if we see this on the X-ray, that we can be assured that we will have stabilization. So crossed pinning for supracondylar fractures. We have the use of intramedullary polymers, also with the same effect of intramedullary pinning, and some of the polymers will be put through the trabecular of bone and will hold them even for torsional forces like the PMMA polymer. And we have descriptions of these techniques way back to the late 70s until nowadays. So people are trying to use them. In Brazil, there was a few years ago research group that was using resinous polymer, castor oil polymer inside the bone to treat avian fractures. They have done it in a lot of species. These most common species in Brazil, like blue-fronted Amazon, blue and gold Macaw, with good success, but I find them very, very hard to use. You have to mix them inside the surgery. They tend to mix with the body fluids and blood and gets very messy. You have a few seconds, a few minutes, not to say a few seconds, to put it on the canal. If you do not put it right, it will polymerize and your result will be worse than it was before. So I do not like to work with intramedullary polymers. It's my personal choice. External fixators are very, very handy to use because we have a very different types of configurations of external fixators. So no matter where is the fracture, you can choose where to put your percutaneous pin. So you can choose how to assemble your apparatus, and this makes these external fixators very versatile, very, very versatile. Um, since they neutralize all forces, bending, torsional, compression, distraction, and shattering forces, I find them very, very, very useful. We have lots of types of external fixators like type 1A, 1B with two percutaneous set of pins. Type 2, which is the one that one pin crosses from one side to another. So the lateral bars that connects the pins, they connected both lateral bars. From the type 1B, this did not happen. And I particularly like the configuration of the tie-in. It's the intramedullary with the external fixator together. They are very easy to set, and they are very strong in neutering forces. Some people say that this part of the apparatus, the pinning coming out of the bone and passing through the muscles around here, this creates pain. But I found them very, very useful and easy to do, especially if we are thinking of minimally invasive osteosynthesis in birds. We have commercial types of external fixators. They are very beautiful to see, but these are of higher price than if we do adaptation with acrylic. I will come to this later. We have cases describing the use of hybrid fixators, a linear fixator with a circular fixator of treating malunion in a bald eagle from these authors here. And this is a very heavy apparatus, only to be used in very large and strong birds. What I tend to do with these larger birds is to use acrylic bars, external fixators. So I choose the diameter of the pin based on the diameter of the bone. I usually use 20% of the diameter of the bone, and it's on the site of the pin introductions. So if you have a bone with different diameters, you can choose different pin diameters to that bone. We should have a minimum of 2 pins per segment of fractured bone if we do not use the intramedullary pin as a tie-in. So if it's not a tie-in, if it's type 1 fixator, we should always use at least 2 pins in each bone segment. I usually do not do these 4 to 5 pins in each segment for a diaphyseal fracture, but if I have a metaphyseal fracture, I will put pins throughout all bone length. So it's a minimum of 2, but they should be spread. The classical way to spread these pins in the bone is putting one far and one close to the fracture, the fracture site, one close and one far to the fracture site. Like I said, if we do a tie-in fixation in birds, we can use only one pin per bone segment, but this is only possible because there is a intermedullary pin inside the medullary canal. So this is an external fixator with acrylic lateral bar. And if we look the books from Harrison, he said that the late edition, but its earlier edition from 1994, we also have this description. He suggests that the ideal implant is the one that should provide quick recovery, allow the use of the member, should be lightweight, provide good stability, be versatile, and have a low cost. So the external fixation with pin and the use of the PMMA acrylic as a lateral bar, I think it's the most inexpensive type of fixation. And since it's very versatile, it can be used in almost every bone and almost every type of fracture. I choose them as my first choice of treating fractures in most cases. There are also other types of external fixations. This one is the same. It's a pin plus external fixator. It's not the tie-in because the pin is not connected to the sidebars. We have the Doyle's technique external fixator. You see them in avian medicine books. It's a type of fixation recommended for simple transverse fracture. We should not use them in oblique fractures and not use them in comminuted fracture. It's two intermedullary pins, both going retrograde, one going out on the proximal part and the other one going out in the distal part. They are then bent, and the rubber band is put in this hook like this. So we have two intermedullary pins that goes out the bone, one distal, other one proximal part. They are then bent externally as in the shape of a hook, and then a rubber band is put creating a compression at the fracture site. This also can be done minimally invasive, so it's a choice. I don't often do them, but if I see simple transverse fracture, we can use them. This is a time-lapse video that with type 2 external fixation doing minimally invasive during the Uttarayan kite festival. You see that we do not use capo blades. We use our own forces to align the member, and we only passes percutaneous pin, two on each fracture site. I apologize for it's not the most a surgery, but like I said, we do not open the skin. And this is what's doing the huge rescue that happens on Uttarayan. So we have lots of waiting cases, so we should be very fast always. So the pins are then bent, and we use cotton bud to soak it on the polymer and the powder of the polymer and put small layers of the acrylic, so it at the end will be very, very, very lightweight. We can do this also with needles for smaller species. This is a ringneck. This is a blue-fronted Amazon with humerus fracture. Here we can see an intermedullary pin. So my first step in surgery is to pass this intermedullary pin so I can restore alignment. And then I will close the surgery, and I'll pass these percutaneous pins. Then I will bend them and apply the acrylic, holding all them together. And we should do a bandage protecting these pins. One disadvantage of the external fixator is that the pin will communicate the bone with the external environment as long as it is there. So as long as the fracture is healing, we have the chance of contamination through the pin. So we should always clean this pin and protect this pin from feces and other dirty debris, and that if we do not want osteomyelitis. So it is very important to clean these pins as long as the fracture is healing. Okay. We have here in Brazil, and I think they are providing worldwide, a specific hinged external fixators, a fixator for exotics, and they were developed with Brazilians. They started this development in 2008, and their main indications are for metaphyseal and or epiphyseal fractures. Like I said, when you cannot put at least 2 pins in this bone segment, then you will use the other bone to hold all the apparatus. And since this apparatus is hinged, it will allow the joint to move, and then we will have a better health joint at the end of the healing process. It is also described as treatment of deformities of growing birds. So when you see those osteochondral dystrophies, you can apply this fixator, and then the bird will continue to grow, and fixator being held at the right place will counteract the bending forces on the bone, and the bone will come back to its normal axis. It is described in parrots and also penguins. So you should look for the work from Vanessa Ferraz and Cássio Ferrino from Brazil to check this external fixator, hinged external fixator. It's awesome. I have them. I've done the practical training, but I did not have any of these particular cases to use them yet. And one thing that I've been trying to use for years in avian orthopedics is the use of plates and screws. And for the last 2 to 3 years, I've been starting the use of these since we have been being able commercial for us is small systems like 1.5 millimeter screws, and now we have a 1.2 millimeter screw locking system. And you have the advantage of only using internal fixators, so you will not have the risk of contamination, and you not need to keep cleaning the pins. You not need to worry about the bird if it is on rain. But otherwise, you will have to do an open reduction internal fixation. I've never seen MIPO applications, minimally invasive plate osteosynthesis, mainly because the muscle attachments on avian bones are a little bit different than mammals. They tend to attach over the full surface of the bone, especially in tibial tarsus, so you do not have a muscle pocket that you can put the plate inside. You need to elevate the muscle insertion throughout all the periosteum to put the plate on it. And this is a more aggressive surgery. So we do not have a perfect implant. All of them will have advantages and disadvantages, and this is what we have to think about. So this is a self-tapping screw. You do not need to tap, and it has this locking head. It's a conical locking head. You can even lock it with a small angled, like 5 to 7 degrees angled screws. And I've been using this in a few cases. The advantage of a locking screw is that you do not it do not require the bone plate surface of contact to hold its forces. Since the head of the screw is threaded and it locks inside the screw hole in the plate, once it's locked, you will not need this bone to plate contact. So it is a better biological environment since the all blood supply can grow beneath the plate, and all the forces will not be compressing this blood supply right beneath the plate. So this is why we tend to use locking plates, and we need to have small implants most of the time. So this is a view of open reduction internal fixation of humerus fracture in Lear's Macaw. That one that took 1 month to be treated. So we had to do a very open surgery. You have to take all the callus that had formated here before. Have to be careful with the radius nerve, and so it's a very aggressive surgery, but we have very good results with it, and I'm really enjoying this these plates for humerus fracture, and I'm not really liking them for tibial tarsus fracture, like I said, because of the amount of muscle that you need to deattach from the bone to put it. But for humerus fracture, I'm using them. I will discuss this a little bit later. So, having shown all the types of fixation that I use, I will now start discussing all the options that we have and how I do these choices. So I tend to always look for birds as emergency patients. We should always take care of the proper admission and history, but we should treat them as quickly as possible. Make sure we stabilize them before we go to second care and before we think on fracture treatment. So first of all, we always stabilize the bird, and then we will think of fracture treatment. And if we have an open fracture, I have a specific flow chart for it, and I will treat the open site as emergency. Of course, I can treat the fracture together with it, but if it's not an open fracture, we have a little bit more time to think. I'm not going inside this too much, but if our bird do not stabilize, we should check for neurological problems. That can be head or spinal trauma, spondylitis, poisoning, parasites, viral, bacterial, and we'll have a specific stabilization treatment for it. Like I said, open fractures, they are an emergency situation. We have this classification adapted. So we have a type 1 open fracture. It's when we have solution of continuity of the skin without bone exposure. This should be treated as open fractures, and we have changes in the protocol. For type 2, we have bone exposure without loss of adjacent structures. So for type 1 and type 2, we radiograph under anesthesia, we clean the wound, and we go for a specific flow chart. And the change in the protocol, we can add metronidazole or clindamycin as an antibiotics, because here we may have exposure to anaerobiotic microorganisms, and we should not forget them. But for type 3 open fractures, it's when we have loss of soft tissue, when we have more of soft tissue damage. And type 3A, even though we have damage on that soft tissue, is it possible to cover with skin? Type B, it's when we need reconstructive procedures to cover the bone. And type C, it's when we do not are able to reconstruct. We should evaluate remaining tissues and consider amputation or even euthanasia if, like I said on the beginning, we do not have a place for this bird. And one thing that we should think is that euthanasia is not condemnation, but maybe a free-ranging bird with a wing amputated, it's condemned to a very poor life. So this is something that I always have in mind. And if I do not previously have proper destination for this bird, and if it's not a threatened bird, I tend to consider to euthanize this bird. So this is a type 3A open fracture. As we can see the bone, we have tissue lost, but here we can clean the bone and cover it with skin. So even though it is an open fracture with soft tissue damage, it is treatable. Very different than this kite string injured owl Let me see if this video will pass. I don't think this video will pass, but we can see that we do not have remaining tissues. It got stuck. Presentation got stuck. Just 1 minute, please. Okay. If we have head trauma, we need to evaluate neurologic function. If it is possible to reconstruct and fix, we will do surgery. If it not, we will consider euthanasia. I recommend this literature for orthopedics conditions of the avian head, and they have specific therapeutics for stabilization of head trauma cases. If we have big fractures, also that same literature is referenced, but what I think is that it is possible to reconstruct. I can use implants like circular wires, for example, in budgerigars or cockatiels. I can even use nylon sutures. I drill 2 holes, one in each side of the fracture, and use a nylon suture to reduce the big fracture, and I will apply cyanoacrylate glue or PMMA acrylic over the nylon suture to protect it, and it's fine. If I cannot fix it, we can consider prosthesis. Prosthesis is not a final solution. It is still require management, but it's one thing to consider rather than euthanasia in very difficult cases. And we always need to check feeding. So the final solution comes when the bird is feeding itself. For wing fractures, we have scapula and clavicle fractures. We should discard respiratory lesions, especially air sac lesions, and we will treat them with a figure of 8 bandage with body wrap. In coracoid fractures, we should also discard respiratory lesions, and in larger birds, there are a few reports. I would not say only a few. We have substantial amount of reports in coracoidal fractures of larger birds like eagles, especially diaphyseal fractures of the coracoids. So you have room to put screws on it. But it's a very difficult access site, and I would not try to do this surgery on less than 1 kilo bird. And I recommend the reading of this literature. It's one of the few meta-analysis articles that we have, and the conclusion is that conservative treatment is better for coracoid fractures than surgery treatments. So this is the conclusion of this paper. So I tend to treat them as a conservative way nowadays. For humerus fracture, you have luxation. If it is proximal, we can try a figure of 8 bandage with body wrap, and always should reconsider the reconstructions of those ligaments. We can do this with nylon sutures. We do not need to drill the bone. We can drill with a bit. We can use the needle attached to the suture to pass the suture inside the bone. If it's distal luxation, we'll do a temporary arthrodesis. If it's epiphyseal fractures, proximal, we'll use conservative approach. If it's distal, we can try to reduce with compression, with a compression screw. We can do a temporary arthrodesis or a figure-of-8 bandage with body wrap. When it's a diaphyseal fracture, now we have enough room to put implants if we have a good-sized bird. For less than 20 grams bird, I will treat this with figure-of-8 bandage with body wrap, and I will try to consider putting a needle as an iron pin to get a better alignment of this bone, but only in as close to 20 grams bird. For cockatiels, for example, I can put an iron pin and a figure-of-8 bandage. For parrots, I can do a intermedullary pin or external fixator like I tie in. And for over than 400 grams birds, I can even try to put plate and screws nowadays. So this is a blue-fronted Amazon with a diaphyseal humerus fracture treated with a tie-in fixation. Oops, sorry. This is the case I've shown before of the Micrastor hawk with a comminuted humerus fracture treated with open reduction and plate and screws. It's not a good result for reintroduction, but it's a good result for captivity program. For radius fracture, I would try to pin this radio if it is a larger bird and if I have open fracture. For example, kite string injuries, usually they also cut the radio, so I already have to do a surgery to reconstruct the propatagium. In this type of cases, I would put a pin on the radius, but mainly only radial, carpal, and metacarpial fractures are treated very good with a figure-of-8 bandage. Fractures of the radials and ulna together, we will need to fix the ulna better. So different from mammals, the ulna is the main passing forces bone. So if we stabilize the ulna, the radial will be stabilized as a consequence. Okay, and for close to or larger than 1 kilo birds, we can try to plate and screw the ulna. This is a very proximal ulna fracture, so epiphyseal ulna fracture. We cannot do anything to stabilize this. This was only treated conservatively. This is a diaphyseal fracture of the ulna, and with a simple fracture of the radials and a multiple fractures of the ulna. So when you have a simple fracture of the radials and we pin the radial, the whole segment is returned to the normal length. Then we can pin the ulna. The ulna is the main bone, and now we'll have enough stability to heal this fracture. This is a radials and ulna fracture of this parrot treated with an external fixator on the ulna. I've shown this, an ulnar external fixator with needles. This is a multiple ulnar fracture treated with external fixator type 1. We can see here that we had contamination through the pins, but when we have stability wins from contamination, and we can have bone healing. But of course, this bird will need antibiotics to treat this osteomyelitis here. This is that caracara that I showed earlier. And the left video, it is on rehabilitation facilities, starting to get physical conditioning again. And on the right video is already being released. But as generally this bird, it's very used to humans. You can see it's being released first walking, then flying. This is a peregrine falco, and it was a few years ago. I was trying to use the plates and screws. I did not have a longer plate. I did not like these at first, and this is the immediately post-operative X-rays. But 1 week later, I got these X-rays, so it gave me. I was very frustrated with these. We changed the plates to external fixation. This fractured healed, but this bird could not be released back because it has a very strong flight, and it requires a lot of anatomic conditioning to reach the full speed. So this bird was not flying well. We did not felt comfortable releasing it back. And one thing that got me in mind with this case is that we need to have specifically designed plates for birds, especially the ulna. We need to have a slightly bended plate to fit properly the ulna. I will not try to plate with a perfectly straight plate the bird's ulna again. And this is something to be developed yet. For hind limb fractures, we have options on the femur. We can do a bandage without weight support. We can firstly pin the femur to restore alignment and then bandage. But when we have birds larger than a parakeet, we can do intermediary pin and external fixators. And only for birds over 1 kilogram, we can try to put plate and screws because the femur is very small comparing to mammals. For the humerus, for example, we can try to plate and screws them for birds over 400 grams. For the femur, only for 1 kilogram. Distal metaphyseal fractures, like I said, we can try to cross pin if the fracture is supracondylar. For the tibial tarsus, we can do the ultimate bandage for very smaller species, and relative small species we can do an IM pin and a ball bandage, or can try a zeal or a splint. And for birds for over the 100 gram, we can try to IM pin and do external fixator. And larger than 300 gram, I already did plate and screws at the tibial tarsus. So this is a bilateral case did by my friend, Dr. Andrea Grespan, with a minimally invasive osteosynthesis approach, intramedullary pin, and 2 percutaneous pin doing the tie-in. And not a single skin incision, so this is a very interesting approach to do. It's a minimally invasive and it heals very well. For the tarsus metatarsus, we can do the ball bandage associated with the ultimate bandage, and for larger than 100 grams, we can try an external fixator. And this is a case of malunion, and for over than 2 months, and we did closing wedge osteotomy approach on this tibial tarsus, and we fixed it with plates, and it healed in 4 weeks. So it can also be done with the tibial tarsus, but like I said, it needs um, a more wider approach. You need to detach all muscles from the periosteum, and I think it's very aggressive approach. I tend to prefer an external fixator at the tibial tarsus than the plate and screw. And for the phalanx, we can do all the ball bandages or the shoe bandages as well. So I think I passed a little bit of the time. Sorry about that, but I appreciate everyone that is present until now. I will be here a few minutes for any questions, but I leave here my email as a contact and my social media pages. I also invite you to check on the Lear's Lear's Macaw Rescue Program page to check for news from this threatened exclusively Brazilian blue macaw that I really love, and represents the most challenging cases of my life. And check that to see all the updates and all the cases that we are treating right now. Okay. So I would like to thank everybody, especially the Indian Society for Veterinary Surgery, in the name of Dr. Divyesh and Dr. Deepak Patil. Thank you, everybody, again.
Thank you, Dr. Plinio. We'll have some questions before you so that if you can resolve the queries that has been raised by the attendees. The first question
Okay.
is, how do you manage toe fractures in parrots?
How do I manage two fractures?
Toe fractures.
I'm sorry, I didn't understand it.
TOE, toe fractures.
Toe fractures.
Yeah.
Yeah, with ball bandages and since parrots are psittacines, we need to put an e-collar on them so they do not rip all the bandage off. I don't think I have a picture of a e-collar, a bird on an e-collar here. I'll have it in another presentation. I will show you some adaptations of bird e-collars. That is a good thing to show. Do you still see my screen?
Yes.
Yes, okay. What are them?
If you don't mind, I'll show that.
Okay.
Here is the collar. You can see this is the collar that is modified. We use the IV bottles that we give fluids. The same IV bottle, we trim it accordingly to the size of the parakeet's neck, and then we fit it accordingly so that the self-mutilation by the parakeet is prevented. So this is a modified collar, the same like we use in dogs and cats, like Elizabeth collar. Similarly, here the small sized collars are not available, readily available in market. So here IV bottles that are being used, they are modified and they are used for as a collar to prevent self mutilation. So here you can see this is one such photograph that we use for parakeets and other birds. Here one more. We'll move ahead with
Yes,
the next
exactly like
question.
that.
The next question is, though you have already described a lot about the same, how do you manage long bone wing fractures in peacock?
In peacocks, I it, peacock is a I would consider them a larger bird with a good bone length. So I would try to put an IM pin and an external fixator, and no matter if it is the humerus or is the ulna or the hind limb fracture. I think the peacock can hold lots of pins and goods of great diameter pins. So a peacock would be a bird to use an external fixator. Or you do not, if you only have one pin, I would do an iron pin and a bandage. And peacock are tend to be easy to handle in captivity, so they tend to heal well.
Dr. Divyesh, your mic is mute.
I'm sorry, yeah. So we'll move on with the next question. That is, how do you manage wound healing and fractures in different birds? Any tips?
Manage wound healing. One thing that always come to my mind is to provide good nutritional support. I think this is the first thing that we need to consider. Um, we tend to see birds eating and assume that they are eating enough, but what I see is that we should provide nutritional supplementation. So this way we will provide a proper nutritional requirement, and we tend to have some difficulties reaching this nutritional requirement for our aquatic birds is a little bit difficult to get this, and birds of prey it's easier because we have we can use those pet commercial food that we find from Royal Canin or from hills like the A and D, and frugivorous birds we can supplement them with chick birds formulas. So first thing is to provide adequate nutritional support, and then we'll do usual wound healing procedures like keeping it clean, keeping it protected, choose proper antibiotics if we have a contaminated wound. We use an antibiotic that is sensible for that the microorganisms are sensible with. Just usual healing techniques. I think that the most challenge that I see in general practice, that people that treat a lot of species and are suddenly challenged with an avian patient, is that they do not provide adequate nutritional support. They see the bird picking the food and assume that the bird is eating enough, and this wound and the whole patient will not be able to heal because it does not have adequate nutritional support. I think this is the first key on the treatment.
Thank you. One more interesting question is coming up, that is, can we use SOP plates in birds?
What type of plates? I'm sorry.
SOP plates.
SOV.
P.
Yes, SOV is like that plate that bends on multiple directions.
SOP plates.
SOP plates, yeah. We can use it. I do not see any contraindication of the use of the SOP plates, but I haven't yet seen any report of its use on birds. Okay, I've never seen any reports of its use, but I don't see why we could not use it.
Okay, thank you. One more question we have is, do you use acrylic material for connecting the pins in ESF?
Yes. I think then are very handy and very low cost to use.
And the next question that is coming is, I know it's a vast topic, but if you can briefly answer the queries, anesthetic protocol in birds. I know you can talk on it about for an hour or two,
Yeah.
but briefly if you can help and answer the query of the attendee, please.
Okay. Dealing specific for orthopedic cases, we will need an anesthesia that is relatively long period, 20 minutes, 40 minutes, sometimes 1 hour of anesthesia. So the main agent that we use for maintenance is isoflurane. We can also use isoflurane for induction. The best agent will be sevoflurane because it's not as irritant as ISO, but I particularly use only ISO. And since we are dealing with cases that has a lot of pain involved with, I think it's very good to associate with analgesics. And this is a very specific topic because we have papers that have proved that some species have certain types of pain receptors and other species have another predominations of pain receptors. So we must choose them specifically, but in general we have we've seen effects of analgesia with use with morphine and tramadol. So I tend to associate one of these analgesic agents with isoflurane. I've done surgery with local blocks anesthesia with lidocaine, for example, and this is very handy also because you can maintain the bird with a very low infusion rate of ISO with this, but their anatomy is very specifically, we cannot do the same blocks extrapolating from mammals. You should look for a specific anatomy of avian nerves to do these blocks. So it's also possible to do them. But basically, I prefer gas anesthesia with ISO. We can use chemical anesthesia only, injectable anesthesia also, with the mix of midazolam and ketamine and some analgesics like tramadol. But since we are speaking of long duration surgeries, you will have to do a lot of shots of these injectable anesthesias, and you will have a larger recovery period comparing with gas anesthesia. So this is why I prefer gas anesthesia. Your mic is muted.
Sorry. Yeah. The next question is just like the previous one, that is it okay to do intramedullary pinning in open fractures?
It's okay to use intramedullary pin in open fractures. Some people say that the pin will allow the infection to go through all the bone, but actually this infection will go through blood supply either way. One thing that I tend to do is to check first if I can cover all the bone. If I can cover the bone with muscle and skin, I can use internal fixation methods. And if I have good stability, the stability will win from the infection and the healing will occur. But also, of course, I will have to use antibiotics. And I always have to plan to remove this pin after healing. If I put an intramedullary pin, I use antibiotics, the fractures heal, but I leave this pin inside, the biofilm that was created, the microorganisms that are still remaining in the pin, at the pin, will recontaminate the bone, and we will have an osteomyelitis afterwards. So we can use internal fixation even in exposed fractures if we have good muscle and soft tissue cover, and we must need to remove these implants after bone healing. Okay.
Thank you. One question is, What do you suggest regarding post-operative medication and dietary management after orthopedic surgery?
Um, well, I think dietary management I already answered with the a few minutes ago with the wound healing. It can be the same answer. You have specific nutritional requirements for specific groups. You have more carnivorous birds, you have more frugivorous, omnivorous. So we need to really do the math, the calculus of amount of calories that the bird are requiring, the amount of calories that we are providing the bird, and check if we are um, getting that requirement. And we should care for pain, so do analgesics. Like I said, tramadol is a good general analgesic that we can use in all species, but we have some specific analgesics like butorphanol and and or fentanyl, for example. And also the use of anti-inflammatories like meloxicam is a very general anti-inflammatory that we can use for all the bird species, and we will control the inflammation, and this will also reduce pain. And the next group of drugs that we must think is the antibiotics. If we have an open fracture, we should think of positive and negative gram bacteria and also aerobic and anaerobic bacteria. So when I have open fractures, I tend to use metronidazole or clindamycin as first choice. If I have a closed fracture, I will only use antibiotics as a prophylactic use. So I do not need to use brand new generation antibiotics or broad spectrum antibiotics. The most common that I use is enrofloxacin or amoxicillin in a few days just for prophylactic usage from the contamination of my surgery. So if I have a very clean surgery, I will only use it at just before surgery and after surgery. If something happened during surgery that it becomes contaminated, I use it a little bit longer. But basically, this is how I think. And I've seen calcium deficiency. This is something that I'm always in mind when I'm treating poultry birds, like domesticated chicken, or in Brazil we have a peacock as a ornamental bird. So it's very common to see the peacocks inside small farms or these small productions as a ornamental bird, and they feed this peacock with broiler food or posture laying eggs food. And when I've done orthopedic surgery in these type of birds, I've always noticed the bone that they are very easy to drill. They tend to fracture if you put circlage wire. So these birds that are treated with production food, I think they are they are on calcium deficiency, so I always supplement calcium for them. For pet birds, as cockatiels and Amazon parrots like these, our commercial foods specifically designed for these parrots, they are very well balanced. Every time I think I'm dealing with a healthy bone when they eat this specific food. But for these like farm animals that are eating production food, I think their bone are very light and very easy to fracture. So I tend to supplement calcium of all of them too.
Thank you. Moving ahead to the closing, we'll see the last question. Is it possible to use plaques on birds like ringneck or cockatiels in tibia?
Plates,
Plaques.
plugs,
Plaques. Plaques.
plaques. Like plates and screws. Would be, I'm sorry, I didn't understand it properly.
Maybe somewhere it is used for dental surgeries. Maybe I don't know, but the question has come up that is it possible to use plaques on birds like cockatiels and ringneck in tibia?
I'm sorry, but I don't know what plaques is. Can you show a picture, Divyesh?
I'll also have to look for it. Just a minute. No. I don't have any idea about it. Sorry. PLA. Sorry, the attendee has written a new spelling that is PLACAS.
Like placas.
Cementing material.
Cementing material. Okay, we can use it. I refer that this at the like an intermedullary polymers fixation type. We can use like the polymethyl methacrylate. It's a bone cement. I even showed a paper where they used castor oil cement, like a resinous oil cement. This is described. It can be used, but I found them very hard to use during surgery because you have very little time between mixing the materials and when they polymerize and became hard. So you have to fulfill the medullary canal very quickly and put the bone aligned together. And it's very seen in a very short period of time. I've seen things going messy during this time, and suddenly you get a bone fulfilled with a cement that is rigid and your bone is not fixed. Then you have to harvest that material outside to start all over again. So I found them very hard to use. So is it possible to use cement materials? But I don't like to use them. It's a personal choice.
Okay. Thank you very much. I think that's the end for the question answer session. So first of all, I would like to thank Dr. Plinio for his excellent presentation. In fact, I'll say an extraordinary presentation for Avian Orthopaedics, and I definitely believe that the presentation will help us in easy decision making for performing surgeries, especially on Avian Orthopaedics. You have described several points that one should keep in mind. The type of implant to be used, the type of surgery to be performed has been elaborated very well by you. So thank you very much for your nice presentation. Further, I would like to thank the President of the Society, Simrat Sagar Singh sir, and the Executive Secretary, Dr. Deepak Patil sir, for their constant support and motivation. I would also like to thank knowledge partner INTAS, Dr. Nitin Bhatia and Dr. Amanjot for their support for the conduct of the webinar, and not forgetting the core committee for organizing, like my team, Dr. Deepak Tiwari sir and Dr. Neelesh Sindhu sir for their support. And last but not the least, I would also like to thank the audience for their patience hearing, and extremely sorry for the yesterday's incidents. Thank you all. Thank you very much.
Thank you, everybody. It was a pleasure for me to speak with you. This is one of the topics that I really like the most, and I could spend whole week talking with you about this. Sorry about my English; it's not my mother language, but I don't think it is a problem for you to understand these different types of accents. And like I said, I'm open to discussions, open to improvement. All these flow charts, they are not solid peer reviewed. They are in constant um, process of elaboration. And I've discussed this a lot of many Indian veterinarians already, and I would be glad to help you making your own and adapting these for your everyday practice. So you can count on me for your, any other doubts and contributions on this topic. Thank you very much, everybody. You have a great evening.
Thank you. Thank you, Dr. Plinio.